Good evening and welcome to this week's Black Mental Health is Black. Black Mental Health is Black Health. I'm your host, Bronwyn Lucas, and we are coming back from our July break and we are jumping right in and we are going to address the issue of Black men's mental health. Yes, that's a segment of the population that sometimes has trouble managing mental health because they don't think it's real or so many things, but we're going to address those. We always like to start with a few deep breaths. Time to take in some deep breaths, clear your head, let more oxygen go through your brain, through your body to help you just relax and chill. So, I'm going to count to four very slowly. As I say, breathe in, I'll count to four slow. Breathe out, I'll count to four slowly. And I want you to do it with me. So let's get started. Breathe in, two, three, four. Out, two, three, four. In, two, three, four. Out, two, three, four. One more. In, two, three, four. Out, two, three, four. How was that for you, Dr. Smith, taking those deep breaths?
It was great for me. I always tell clients to do it, but I often don't get to do it. So it's a good way to end the day.
Awesome. Yes, we don't get to do it as much. I go online every day and do a positive thought, have people deep breathe, but I'm busy telling them, you're right, we don't get to do that often. Well, I'd like for you to introduce yourself and tell us something cool about you.
Thank you so much. I am Joshua P. Smith. I'm a licensed professional counselor. And something cool about me, I started preschool early. Um, so I went to a private preschool. And because my birthday is September 1st, I was right on the cutoff of
Hmm.
getting in. So I was always the youngest in my class. But I did start early, and it gave me a good head start in life.
Awesome. That's cool. That is a unique fact. Well, I understand that you are a mental health professional here in the state of Texas. You're in the Dallas area. Where exactly are you?
Houston.
Oh, Houston. Okay. That's right. And you just recently moved to Texas, correct?
Correct.
You're in Houston, my hometown. So, yes, love that. Before we jump into dealing with Black men's mental health, we don't often see a lot of Black male therapists. So, what made you even want to become a therapist? Because you probably didn't see a lot of role models. I'm just speculating here, a lot of role models growing up. So, what drew you to this field?
Yeah, great question. I actually didn't see any um, black male therapist. I don't even remember seeing any black therapist. That was
Mhm.
the thing that was talked about in the 90s, from what I can remember. But I've always been that guy, that kid that people would come to and just tell their life story, tell their problems. And I remember being 11, 12 years old and having grown adults telling me their issues. And I realized later it was my capacity to listen, and sometimes it was my capacity to advise, but mostly my capacity to listen. And so it just kind of developed from there, just a natural gift of counsel to help people grow and help people heal. So I love what I do, but I did not see many models of it growing up.
Mm. Well, I'm glad you jumped in it. So, just looking at let's in general dealing with Black men and therapy. Is that what you see mostly in your practice?
Yes, so about 80%, give or take, of my caseload in my private practice are Black men. And so I consider that an honor to be trusted
Hmm.
by Black men who usually go to the barbershop before they go to therapy. And there's nothing wrong with the barbershop. But I count it an honor to be trusted. So, yeah, about 80% are Black men.
Wow. So you're getting them in there, and that's great.
Mhm.
Um, What are some issues in general? Are there some general things you might see in dealing with this population?
Yeah, so I see a lot of depression. I see a lot of anxiety. I see also a lot of relationship issues. So a lot of interpersonal relational issues. A lot of men come to me because they are having some type of relational issue, or they're not feeling themselves, or the person in their life has said to them, "You need to get some help." So that's kind of along the plane of people that I see. But yeah, those things, anxiety, depression, and even trauma. But once we start digging, because many people don't come to therapy to do trauma work, at least not a lot of men. But the way that I counsel and my modalities that I use, once I start digging, then we start hitting what I call gold, which is the trauma.
Mhm. What kind of modalities do you use?
Yeah, so I use CBT, which is cognitive behavioral therapy. I use trauma focused cognitive behavioral therapy. And I'll also plug that coming out of my doctoral program, I actually created a modality called Soul Healing Integrative Psychotherapy, which deals with depression, anxiety, and trauma. So it's a mix, what we call a assimilative integration. It's a mix of different therapies and techniques that I put together, did the research on. And so that's mainly what I use in my practice.
Now, you know you're going to have to tell us more about that. It sounds totally intriguing. So break that down a little more.
Yeah. So I usually do what I call SHIP, which is Soul Healing Integrative Psychotherapy. I usually do that in 8 to 10 sessions. It is strengths based, solution focused. As I like to say, it gets you in and out, but it really does do a deep dive to deal with your cognitions, the way that you think, and how it's contributing to what you feel. I do assessments to measure where people are, and I track those assessments throughout the process to see if there have been any changes. I remember doing my doctoral research, and the client that I did a project on actually saw a decrease. He was a Black man in his 20s. He actually saw a decrease in his depression scores on paper. He
Mm-hmm.
self-reported that his feelings of depression, his feelings of worthlessness, hopelessness, like those things began to decrease, and there was an increase in joy. There was an increase in the goals that he was achieving. He had trouble going back to school. He couldn't focus. He couldn't focus. He couldn't just get the motivation that was necessary. But once we started doing our sessions and doing a deep dive into his life and doing the work, he went back to school, right? And I believe he's about to finish that program. So I've seen some results with this, and so that's why I love using it.
Awesome. You mentioned you treat anxiety, depression, and even trauma. I'll come back to the trauma in a minute. How prevalent would you say is depression within Black males?
I don't even have a number, but I can't think of one Black male that has come to session with me that does not have depression on some level. So we know that there are different types of depression. There's a spectrum of depression,
Mm-hmm.
which is why I say I can't think of one that wasn't on that spectrum in some way, from mild to moderate to severe, to major depressive, bipolar, um, even functional depression, which isn't something that's clinical, but it's something that's seen. So
Mm-hmm.
I can't think of a client that has ever come into my office that was a Black man that wasn't experiencing some type or some level of depression.
You hit on something that I want you to elaborate on, and that is functional depression.
Yeah.
Because what people tend to think when they think of depression is someone who's just sitting, oh, they just can't function, they can't get off the couch. But there are people who are functioning, and they may, well, I'm going to let you talk about it.
Yeah. So I like that you said that because it is a thing. So when you think about functional depression, you can think about functional alcoholics,
Mm-hmm.
right? So it's pretty much the same thing. It's a person that can get up and go. They don't have the outward signs of a depressed mood, but inwardly they do. their external manifestation of it may be to work, right? It's kind of like what you hear often when there's been like a death in the family or a loss. You hear people say, well, I want to work through it. Like, I got to get back to work. I got to get my mind off of it, right? So that's kind of what you see. Particularly, I see that in Black men who have culturally been taught that what they do and how much they bring to the table is more valuable than their emotional state. If you've been given that type of messaging, whether it was directly given or indirectly given, it's ingrained in you, and you feel like you are less of a man if you have to stop and check in, or if you have to stop and acknowledge that this is what I'm feeling. More often than not, when someone comes into my office and they're a Black male and they're dealing with functional depression, they've come to the point that is their breaking point. Like, they either are there, which means they've done something or acted erratically or said something, right? Or they're headed there and they recognize something isn't right. Like, I don't know how to really talk about this, but something is off.
And I like to think too that you have the person who's functionally depressed, but by the time they get to therapy, they're no longer functioning.
Right.
It's tipping them over. They've been doing it maybe even for years.
Yes.
When they stuff their emotions, they ignore their emotions, and it may be one little thing, and they don't even understand why this tipped me over. Well, it was that final straw.
Yep.
It was that last, I call it the last puff of air in the balloon that made the balloon pop.
I like it.
And I think I see that with both men and women.
Yes.
And that's why I really wanted to look at that. Anything else you'd like to say about depression? Because it is so, that was just the functional depression. But as you say, there's so many types of depression. And the reason I want to stay there for a minute, it is a major issue in our community, men and women. But men really don't want to deal with it. What else could you say that might help someone in this journey?
Yeah, it's so major that even doctors now, medical doctors, are giving assessments for depression. So that should show us how prevalent it has become, that even they are wanting to assess, because your mental health, it plays a factor in your physical health, right? It plays a factor in your emotional wellness, in your relational wellness, in your spiritual health. So, there is no health without mental health. So if you're feeling like something is off, or you're not able to do the things that you used to do, or you're not feeling that same motivation, it's best to just come in, get an assessment. We can use our clinical judgment, so you don't have to figure it out, right? Sometimes you don't have to WebMD, like, I went to school. I don't need you to do that. I don't need you to do your symptoms. Come tell a professional what those symptoms are, and we'll use our clinical judgment and assessments that will help us to see where you are and create a treatment plan so that we can actually work through the issues that you're dealing with.
That was a good explanation of just coming to therapy. So thank you, because I think men and even women, I deal with both, need to hear it, because that can be part of the fear, for lack of a better word. There really is a fear about coming. And I like the way you break it down. Very simple. It's easy to understand. I see a lot of women who deal with anxiety. What about men? Do you see a lot of anxiety in Black men, knowing that anxiety and depression kind of go together?
Yeah. So I do see it, but the way that it presents in men may not be the same for women. So I always, generally, as a best practice, I always give a depression assessment and an anxiety inventory, right? Because I just want to see, because sometimes the symptoms that are being presented, you don't know that it's anxiety. Right. So again, coming to a professional, they're able to look at it and see what's really happening, and then properly assess what it is. So I when I counsel women, they're usually more outward with saying, like, I feel nervous, I feel all over the place. I feel like they're more apt to say that, where men are usually not. They may say something like, I just don't feel like myself, or something like that. Like they may not have the language, and that doesn't mean men are any less smart than women. But when it comes to emotions, culturally, that cultural piece comes in again. That you don't hear other men talking like that. So when you feel something within yourself, you may not have the language for it.
Mm-hmm. And not having the language is just not even understanding that that's anxiety. Like you say, I'm just not feeling myself. I don't feel right.
Right. I feel on edge. I hear that a lot.
Hear what?
On edge. I hear.
Yeah, I'm just yes. I'm just on edge. I just don't know. I don't even know why. Yeah. I feel like I'm managing it. And you're right. When you go to your PCP now, they're going to do a depression and anxiety screening. Yep. And for some, just taking that is like, oh, well, what does that mean? Which is good though, because it opens their eyes and it normalizes it. If they have questions that fit this, you're obviously not the only one who is feeling this. Yeah. I wanted to go back to something you said earlier. You said that African-American men have been taught to value what they do, what they bring to the table, more than an emotional state, maybe. And so, you hear about people defining themselves based on their job, what they do. Who are you? I'm an engineer. I'm a cook, whatever. But that's not who you are. Right. But how does that play into having an unhealthy emotional state?
Yeah. So if you are only defining yourself by what you do and you're not really in touch with who you are, then as long as you're doing what you do, then you're fine. Right? But when it is time to pull back and deal with life, deal with relationships, deal with your emotions, many men struggle with that because particularly for us, we're taught to wrap our entire identity around what we do. Mm-hmm. So as long as we're doing what we're doing, it's not making any waves, it's not causing any problems. The man is being the man, right? Doing what men do, work, provide, etc. But you're also a human being. Okay, you're not a machine, you're not a robot. Mm-hmm. You're a human being. And so again, and I see this a lot with men who may have like a disability or something that has caused them to not be able to work, or they lost their job, right? That's a common thing, that men come to therapy for. So why is it that you're in such a state, not a judgmental question, but why is it that you're in such a state of despair because you lost your job? It always comes back to this is connected to my identity. And I have to work to provide for my family, which is true, right? But let's deal with how do you even feel as a person about having lost that job? What are your goals for the future after having lost that job? So really making you feel like you are a human and not someone that needs to just get back to doing something so that you feel better. No, let's deal with why you don't feel the same since you're not working anymore.
Mm-hmm. And for some males, that is the first time they had to think about, this whole idea, because I've been so wrapped up into, this is who I am. And now that that's gone, I've got to face, who am I?
Me.
And that can be scary.
Yes, absolutely.
I don't use that word scary when I'm talking directly to men because, that's not a thing, but it is a fear. I want, and then sometimes I will bring it up, but after they're comfortable. I don't know that word. How do you find the use of that word? Because fear really is a part of it. Fear to come to therapy, fear of, I don't know. How does fear, do you see that as something Black men have to deal with?
Yeah. So, I'm a pretty direct person. So I may ask it in terms of like, what are you afraid of? Or if X were to happen, what are you afraid why it would lead to? That kind of thing. So I don't try to assign an emotion.
Right, for sure.
Right. But I will ask to get them thinking in terms of, okay, am I afraid of something? Is there something that can potentially consume me or overpower me? right? Because when you're dealing with men, of course, you're dealing with the strength, right? And they want to maintain that strength, even though therapy is a vulnerable place. So I may not do it the first session, but as we keep going, I may ask that, like, what are you afraid of?
Mm-hmm. Yeah, as time goes on, and I think it's part of the reality of helping them face just what's out there.
Yeah.
Okay, go on a minute. Don't you find this? I would think it might be a little scary to do that, to feel that way. And then when you put it on the table, but like I say, I wait a little while longer. But when you put it on the table, it's like, oh, well, yeah. I actually had somebody say, well, yeah, that is scary. I was like, okay, now we can talk.
It's okay. You have to realize that it is okay to be afraid of something.
Mm-hmm. What age range do you see? Are you seeing more younger, more older? How are Black men approaching therapy age-wise?
Yeah, so I'm seeing more 20s and 30s.
Mm-hmm.
When I first started my practice, I was seeing more 40, 50, 60.
Mm-hmm.
Yeah. Now I would say it's a good mix, probably more in that mid age range. And then they start referring their sons. So I have some duos. I have some males that are in their 30s, 40s, and then their sons in their teens that are also clients. So I can see anywhere from 8 years old to 60 years old.
Yeah, I was just about to ask, what is your range that you're seeing right now? And I see that as well now. You're seeing a broader range. I think when I started out, it was more that 30s, 40s, but now much younger. And I'm seeing middle school kids saying, okay, I need to go talk to a therapist because I'm not happy.
Yeah.
Okay, great. And I applaud parents who will say, well, Mom, I can't talk to you. I really need a therapist.
Yeah.
And I applaud parents who can say, okay, I'm going to find that for you.
Yeah. And I'm going to do that work myself. That's applaudable as well.
It is. And then I'm seeing older. I mean, I have 2 clients in their 80s.
Wow.
And first time they ever came, dealing with grief and other things. And that's amazing because thinking about African Americans who are in the 80s when they were in their 30s and 40s, do what? Go to who? Therapy. We don't do that.
No.
So I think it's really cool. I think over my career, I probably have maybe 7 or 8 people in their 80s.
That's great.
Come to therapy, and it was the first time. Came for various issues. One is, I've been depressed all my life, and even though I feel like I'm at the end of my life, I don't want to be depressed anymore. Great. That was a place to start. Yeah. Finding a therapist is not an easy thing. What are some things Black men, or really just Black people in general, but we are focusing on Black men, so there may be some unique things. What would you say to a person who's listening if they, okay, I think I want to do this therapy thing? What could you tell them?
What I would tell them is to start doing some research on what therapist would work best for them. I always tell people you are the client, and as much as you may not feel like this, as much as you're not told this, you are in charge. Okay, I'm following your lead, and so I encourage people to interview therapists. Most therapists will either give you their email address, they'll have some type of form, or they'll offer a 5 to 10 minute consultation. Take advantage of that. Ask questions. All therapists are not created equal. All therapists don't specialize in the same things. So I would say if for a place to start, you may want to start with your primary care doctor, see if they have a list. I've had a lot of people to come to me because unbeknownst to me, I was on the list from their primary care doctor. I love it. That's great. So they did that. They Googled me. I mean, we got to do this like we do everything else, right? We're going to a restaurant. We want to see the reviews. We may want to look at the menu. It's the same thing. So make an informed decision about who it is that will be the best fit for you. And give it a couple of sessions, right? After a couple of sessions, you may find that the therapist you selected is not the best fit. I always tell people you can make a pivot you can change. I say this particularly to African Americans because inside of our culture is loyalty,
Mm-hmm.
right? So we'll go to the same doctor for 50 years because that's who grandma went to, great uncle went to. Like we keep it in the family and we'll stay loyal even though we may need to make a pivot. So
Mm-hmm.
we are extremely loyal to our healthcare providers. It is okay to make the pivot when it's not working for you because you're spending your money, you're using your insurance. Again, you're in control of this. So you need to have someone that can really help you and someone that's the best fit for you.
I think that's important. At the end of all of my initial sessions, I do my intake and we're talking. I always ask, am I someone who you feel like you'd be comfortable talking with? If not, please say it. Don't just not show up or don't keep coming back.
Right.
I want to help you. I will help you find someone else if I'm not the one.
Likewise.
And if somebody says I don't know, I'm okay with that because I'm not everybody's cup of tea.
Yeah.
You may find somebody. Also, I have, I tell people, like you say, Google the person, go to if they don't have a website, I'm wondering why don't they, in this day and age, go to their website, look at them. I see if they're on Psychology Today.
Yes.
That's another way to vet someone. Right. So I think it is important to go in, vet that person, see how they mesh with you. Sometimes I've had clients say, I just got a good vibe when I looked at your website and you on Psychology Today, and they called because they had a good vibe. And I think that's important because we do, how you feel about someone.
Yes, agreed.
So those are some really good things. Before we wind down, we're about at the end of our time. Are there any other things you'd like to say to Black men to nudge them toward getting help with their mental health?
Yeah. The final thing that I will say is do this for you. Again, I've had plenty of men to come in because their spouse or their significant other pointed out something, and that can be good, but you have to want to do the work. And you have to know that you need to do the work.
Mm-hmm.
Like we all do. I am one of those therapists that is of the belief that everyone needs therapy. I don't think anyone gets a pass from therapy,
right.
But we don't all embrace it.
Mm-hmm.
It's work. It is, but it's worth it. And you are worth it. So do it for you and not anyone else.
I think that is an excellent way to wind down this. As we end our first week back, I want to say things about where we're going forward. And this year we'll continue. And some things coming up. I have some children authors. Yes, young children that have written their own books and are selling them, have published and are selling their own books. We're going to talk later this month about the prison system and how that impacts our mental health. I have an advocate who she is an advocate against the death penalty and is a wealth of knowledge, unbelievable. So we have a lot coming up. I hope you'll continue to join us. We always end each week with a call to action. My call to action to you is this. Take your mental health seriously. Make it an effort to go find a Black male in your life and get them to go to therapy because they're less likely to go. So get another Black male out there and say, hey, kind of guide them to that path. And maybe you need to go yourself. If you haven't gone, you go yourself. So I am Ms. B. I'm Bronwyn, the Black Couch Therapist. I'm here to help you become a better you. I will see you next week, and thanks for joining us on Black Mental Health is Black Health. And thank you, Dr. Smith.